HESI EXIT Newborn Assessment and Care. Welcome to HESI EXIT Maternity Nursing, Newborn Assessment and Care. This comprehensive guide will help you understand newborn assessment, transition to extrauterine life, and essential nursing care for the healthy newborn. Introduction to Newborn Assessment. Newborn assessment focuses on evaluating the infant's successful adaptation to life outside the womb. Definition. Newborn assessment evaluates the infant's transition to extrauterine life. Care ensures optimal health and early detection of problems. Systematic evaluation follows a standardized approach. Key aspects. Initial assessment includes APGAR scoring and vital signs. Ongoing monitoring involves head-to-toe examination and reflex testing. Essential newborn care encompasses thermoregulation, feeding, and safety. Parent education prepares family for home care. Immediate newborn care. The first 60 minutes after birth are critical for newborn transition. Drying and warming. Dry baby immediately to prevent heat loss. Remove wet linens and replace with warm, dry blankets. Prevent heat loss through convection, conduction, evaporation, and radiation. APGAR scoring. Quick assessment performed at 1 and 5 minutes after birth. Evaluates 5 key areas of newborn status. Airway management. Suction mouth first, then nose using bulb syringe. This prevents aspiration if baby gasps. Skin-to-skin contact. Place baby directly on mother's chest. Encourages bonding and temperature regulation. Facilitates early breastfeeding. Cord clamping and care. Delayed clamping benefits newborn iron stores. Keep cord clean and dry. Monitor for bleeding or infection. Identification bands. Place matching bands on mother and infant. Ensure security and proper identification. APGAR scoring system. The APGAR score provides rapid assessment of newborn condition. Scoring at 1 and 5 minutes. Uses a 0 to 10 scale. Each category scored 0, 1, or 2. Scores are added for total. 5 categories. Appearance evaluates skin color. Pulse measures heart rate. Grimace assesses reflex irritability. Activity evaluates muscle tone. Respiration checks breathing effort. Interpretation. 7 to 10 indicates normal, healthy newborn. 4 to 6 shows moderate distress requiring intervention. 0 to 3 indicates severe distress requiring immediate resuscitation. Clinical significance. Low 1-minute score indicates need for intervention. Low 5-minute score may predict neurological outcomes. Repeated every 5 minutes if score remains low. Initial vital signs. Newborn vital signs have specific normal ranges. Heart rate. Normal range is 110 to 160 beats per minute. Listen at the apical pulse for a full minute. Rate may be as high as 180 with crying. Bradycardia below 100 requires evaluation. Respiratory rate. Normal range is 30 to 60 breaths per minute. Pattern is irregular and may include periodic breathing. No retractions, grunting, or nasal flaring should be present. Temperature. Normal range is 36.5 degrees Celsius to 37.5 degrees Celsius, 97.7 degrees Fahrenheit to 99.5 degrees Fahrenheit. Axillary measurement is preferred. Maintain neutral thermal environment. Blood pressure. Normal range is 60-80/40-50 mmHg. Not routinely measured in all newborns. Measured if concerns about cardiac status. Physical examination, general appearance. A systematic head-to-toe examination identifies normal findings and abnormalities. Skin. Should be pink with good color. Acrocyanosis, blue hands and feet, is common and normal. Vernix caseosa, white, cheesy coating, may be present. Lanugo, fine body hair, may cover body. Check for rashes, birthmarks, and bruising. Head. Molding from passage through birth canal is normal. Fontanelles should be soft and flat. Anterior fontanelle closes by 18 months. Posterior fontanelle closes by 2 to 3 months. Eyes. No tears are produced initially. Red reflex should be present in both eyes. Check for discharge or swelling. Ears. Should be level with eyes. Well formed with cartilage present. Check hearing response. Mouth. Inspect palate for intactness. Sucking reflex should be strong. Check for thrush or abnormalities. Head and face assessment. Detailed head assessment identifies normal variations and abnormalities. Fontanelles. Anterior fontanelle is diamond-shaped. Located at junction of frontal and parietal bones. Closes around 18 months of age. Posterior fontanelle is triangle-shaped. Located at junction of parietal and occipital bones. Closes by 2 to 3 months of age. Should be soft and flat, not bulging or sunken. Caput succedaneum. Edema of the scalp. Crosses suture lines. Resolves within a few days. No treatment needed. Cephalohematoma. Blood collection under the periosteum. Does not cross suture lines. May take weeks to months to resolve. Monitor for jaundice as blood reabsorbs. No treatment needed unless severe. Newborn reflexes. Primitive reflexes indicate neurological integrity. Moro reflex, startle. Elicited by sudden movement or loud noise. Arms extend then draw back with fingers spread. Disappears by 4 to 6 months. Rooting reflex. Baby turns head towards stimulus on cheek. Helps with breastfeeding. Disappears by 4 months. Palmar grasp. Baby grasps object placed in palm. Grip is surprisingly strong. Disappears by 4 to 6 months. Babinski reflex. Toes fan out when sole of foot is stroked. Disappears by 1 year. Stepping reflex. Simulated walking motion when held upright. Feet make stepping movements. Disappears by 2 months. Significance. Presence indicates intact nervous system. Absence or asymmetry may indicate neurological problem. Respiratory system assessment. Respiratory adaptation is critical for newborn survival. Normal findings. Respiratory rate of 30 to 60 breaths per minute. Irregular breathing pattern is normal. Periodic breathing with brief pauses up to 15 seconds. Obligate nose breathers must have patent nasal passages. Abnormal findings. Retractions, chest pulling in, indicate respiratory distress. Grunting sounds suggest difficulty breathing. Nasal flaring shows increased work of breathing. Central cyanosis around mouth and torso is an emergency. Apnea lasting more than 20 seconds requires intervention. Nursing interventions. Position baby on back for sleep. Keep nasal passages clear. Monitor oxygen saturation if indicated. Report abnormal findings immediately. Cardiovascular system assessment. Cardiovascular assessment ensures adequate circulation. Heart rate. Normal range is 110 to 160 beats per minute. Murmurs may be heard and are often normal. Patent ductus arteriosus may cause transient murmur. Cyanosis monitoring. Peripheral acrocyanosis, blue hands and feet, is normal. Results from sluggish peripheral circulation. Central cyanosis, around mouth and torso, is abnormal. Indicates inadequate oxygenation. Capillary refill. Press on skin and release. Color should return in less than 2 seconds. Delayed refill indicates poor perfusion. Pulses. Check brachial and femoral pulses. Should be equal and strong bilaterally. Weak or absent femoral pulses suggest coarctation of aorta. Gastrointestinal and genitourinary assessment. GI and GU systems require careful monitoring in the first days. Gastrointestinal system. Suck-swallow reflex should be coordinated. First stool is meconium within 24 to 48 hours. Meconium is thick, sticky, and dark green-black. Transitional stools follow, becoming yellow-green. Breastfed stools are loose and golden yellow. Formula-fed stools are firmer and tan-colored. Genitourinary system. First void should occur within 24 hours. May void at delivery. Brick dust in diaper, urate crystals, is normal in first days. Reddish color may alarm parents but is benign. Monitor for adequate output, 6 to 8 wet diapers by day 5. Nursing responsibilities. Document first void and stool. Educate parents on normal patterns. Monitor for constipation or diarrhea. Assess for adequate hydration. Newborn screening and prophylaxis. Preventive interventions protect newborn health. Vitamin K, IM injection. Given within 1 hour of birth. Prevents hemorrhagic disease of the newborn. Newborns lack intestinal bacteria to produce vitamin K. Administered in vastus lateralis muscle. Erythromycin eye ointment. Applied to both eyes within 1 to 2 hours of birth. Prevents ophthalmia neonatorum. Protects against gonorrhea and chlamydia infections. Required by law in most states. Hepatitis B vaccine. First dose given within 24 hours of birth. Especially important if mother is HBsAg positive. Part of routine immunization schedule. Additional doses at 1 to 2 months and 6 to 18 months. Newborn metabolic screening. Heel stick blood test before discharge. Screens for PKU, phenylketonuria. Detects hypothyroidism. Identifies cystic fibrosis. Tests for sickle cell disease. May include other conditions depending on state. Thermoregulation and heat loss. Maintaining body temperature is critical for newborn survival. For mechanisms of heat loss. Conduction occurs through direct contact with cold surfaces. Prevented by warming blankets and using skin-to-skin contact. Convection results from air currents and drafts. Prevented by keeping baby wrapped and away from vents. Evaporation happens through moisture on skin. Prevented by drying baby immediately after birth. Radiation transfers heat to nearby cool objects. Prevented by keeping bassinet away from windows and exterior walls. Brown fat metabolism. Newborns use brown fat for non-shivering thermogenesis. Brown fat is located around neck, shoulders, and vital organs. Generates heat through metabolic processes. Depletes with cold stress. Nursing interventions. Maintain neutral thermal environment. Monitor temperature regularly. Use radiant warmers or incubators if needed. Keep head covered as significant heat loss occurs through head. Warm all equipment and surfaces. Feeding and nutrition. Adequate nutrition is essential for newborn growth and development. Breastfeeding benefits. Exclusive breastfeeding recommended for first 6 months. Provides IgA antibodies for immune protection. Promotes bonding between mother and baby. Reduces risk of infections and allergies. Supports optimal brain development. Formula feeding considerations. Standard formula contains 20 calories per ounce. Feed every 3 to 4 hours on demand. Proper preparation and storage are essential. Bottle position prevents ear infections. Signs of readiness to feed. Rooting and turning towards stimuli. Sucking motions and movements. Hand-to-mouth movements. Increased alertness. Crying is a late hunger cue. Feeding frequency. Breastfed babies feed 8 to 12 times per 24 hours. Formula-fed babies typically feed every 3 to 4 hours. Feed on demand, not by strict schedule. Monitor output to ensure adequate intake. Common neonatal conditions. Some conditions are common in the newborn period. Transient tachypnea of the newborn, TTN, caused by retained fluid in lungs. More common after cesarean birth. Resolves within 24 to 72 hours. Supportive care with oxygen if needed. Hypoglycemia. Blood glucose below 40 milligrams per deciliter. Signs include jitteriness, poor feeding, and lethargy. Treated with early feeding or 4 glucose. Monitor at-risk babies, IDM, LGA, SGA. Jaundice. Physiologic jaundice appears after 24 hours. Results from immature liver function. Pathologic jaundice appears before 24 hours and needs evaluation. Treated with phototherapy if levels high. Monitor bilirubin levels. Meconium aspiration syndrome, MAS. Occurs when baby inhales meconium-stained fluid. Causes respiratory distress. May require oxygen and mechanical ventilation. Prevention includes suctioning at delivery. Safety and infection prevention. Safety measures protect newborns from harm and infection. Safe sleep guidelines. Always place baby on back to sleep. Reduces risk of sudden infant death syndrome, SIDS. Use firm, flat sleep surface. No loose bedding, pillows, or stuffed animals in crib. Avoid co-sleeping with parents. Room sharing without bed sharing is recommended. Infection prevention. Practice hand hygiene before handling infant. Most important measure to prevent infection. Limit visitors, especially those who are sick. Avoid crowds in first weeks of life. Keep baby away from people with cold sores. Ensure proper cord care until stump falls off. Car seat safety. Baby must be in approved car seat for discharge. Rear-facing seat until at least 2 years old. Proper installation and harness adjustment critical. Never place rear-facing seat in front of airbag. Educate parents on correct use. Parental education and discharge planning. Comprehensive education prepares parents for home care. When to seek medical attention. Fever above 100.4 degrees Fahrenheit 38 degrees Celsius is always serious in newborns. Poor feeding or refusal to eat. Lethargy and difficulty waking. Difficulty breathing or rapid breathing. Excessive crying or inconsolable baby. Jaundice spreading to arms and legs. Fewer than 6 wet diapers per day after day 5. No stool for several days. Discharge instructions. Cord care and bathing. Feeding schedule and techniques. When to call pediatrician. Follow-up appointment timing. Normal newborn behaviors. Sleep safety guidelines. Follow-up appointments. Pediatrician visit within 3 to 5 days post-discharge. Weight check to ensure adequate intake. Jaundice monitoring if needed. Newborn screening results follow-up. Summary. Let's review the essential concepts. Key takeaways. APGAR scoring and initial stabilization are crucial for identifying problems early. Systematic assessment ensures comprehensive evaluation of newborn health. Newborn screenings and vaccinations prevent serious complications. Thermoregulation is critical as newborns cannot shiver. Parental education ensures long-term newborn well-being and safety. Early identification of problems improves outcomes. Thank you for watching Newborn Assessment and Care. You now understand how to assess and care for healthy newborns and identify potential complications. Your knowledge will help you provide excellent newborn care and support new parents.